Geriatric vision and hearing presentation. Two body systems that I'm going to go over within the geriatric population are vision and hearing. Contrary to popular belief, vision loss is not an inevitable part of the aging process, but rather age-related changes contribute to decreased vision. Vision loss is a leading cause of age-related disability in people over 65 years of age. Loss of vision affects a person's ability to function in their most basic daily activities of life. Changes in geriatric population dealing with hearing loss. The broad consequences of hearing loss have both functional and clinical significance and should not be viewed as something a person just accepts as part of their aging process over time. Hearing loss is the third most prevalent chronic condition and the fourth most communicative disorder of older adults within the United States. It is a result of multiple different factors, and some are modifiable, such as lifestyle and environmental factors, and others are non-modifiable, including genetics. There are two forms of hearing loss, sensorineural and conductive. Sensorineural results from damage to any part within the inner ear, and conductive refers to abnormalities of the external and middle ear that reduce the ability of sound to be transmitted into the middle ear, causing the loss of hearing. Assessment changes related to vision. There are both functional and physical changes that occur with aging. Physical can include eyelid sagging, and functional include the cornea becomes flatter, thicker, and less flexible, causing more rigidity. There is a possibility of thickening and yellowing of the lens along with reduced flexibility, which increases the need for extra lighting in older adults for them to see. Presbyopia is an age-related decrease in near vision that begins to become more noticeable in midlife, and nearly 95% of adults over the age of 65 wear glasses for close vision. 95% is quite a lot, so that's why a lot of people just assume that vision loss and glasses, old age go together. However, that is not a normal part of aging. Eye responsiveness is diminished intraocularly, and physically there is a loss of elasticity. Assessment changes related to hearing. Atrophy of cerumen glands cause extra thick and dry cerumen, which increases the risk for impactions that will cause a temporary but reversible obstructive loss of hearing until those are removed. Presbycusis is stiffening of the joints within the ear, which causes sensorineural hearing loss, and sensorineural hearing loss is a permanent type of hearing loss. Physical changes of the ear will occur, especially in older adult men, when the auricle becomes longer and wider due to the elasticity being lost, and the lobe will begin to sag. The cerumen impactions must be removed before hearing can be assessed, because without the impactions being removed, the tympanic membrane cannot be visualized. Pathophysiology of vision loss. In the United States, the leading causes of visual impairments are cataracts, glaucoma, diabetic neuropathy, and age-related macular degeneration. Dry eye is a very common thing in older adults. It's a multifactorial disease of the tears and ocular surface, and it results in visual disturbances because of the dryness. It is constantly irritating and uncomfortable to the patients. It is accompanied by increased osmolarity of the tear film, and subacute inflammation of the ocular surface, causing that constant irritating sensation. Cataracts are a very common problem in the older adult population. Cataracts are associated with aging because they don't just develop directly over time. They take time to come about and make that cloudiness in the lens. Age-related and other medical conditions cause tissues within the lens to break down and begin to clump together, causing that cloudy area within the lens and vision to become blurry. The natural lens is a crystalline substance and a precise structure made up of water and protein, which create that clear lens. And just like in the picture, there is a normal clear lens, and then when the lens is clouded, the vision appears to be white and filmy, and it is only removed by surgery. Age-related macular degeneration is a loss of the central vision. Retinal pigment epithelium play a critical role in keeping the cones and rods healthy and functioning well. Accumulation of waste products from the rods and cones can result in drusen, which appear as the yellow spots. Just like in the picture, it is the central vision where the dots impede on the vision. Pathophysiology of hearing loss. There are two types of hearing loss, sensory neural and conductive. And sensory neural is a result of damage to any part of the inner ear or the neural pathways to the brain. Conductive hearing loss occurs secondary to lesions in the external auditory canal, tympanic membrane, or the middle ear. These lesions prevent sound from being effectively conducted to the inner ear. And the difference between sensory neural and conductive is that conductive hearing loss can be reversible, whereas sensory neural is a non-reversible hearing loss. Presbycusis is a small, common age-related loss of hearing that has symmetrical, progressive loss of hearing over many years. It does not abruptly develop. It usually affects the high frequencies of hearing. Tinnitus is caused by abnormal neural activity in the auditory cortex, and this activity results when input from the auditory pathway is disrupted or altered in some manner. This disruption causes a constant noise that persists and can become very irritating for the patient. In the chart, these are different types of sound that patients report hearing, and it's not all just one sound. Everyone hears something different constantly. Education for visually impaired patients and their families include keep areas well lit and do not rearrange the room. If the person is blind completely, you can ask them how you can help. And if walking, do not try to push or pull. Ask for preferences that they prefer. Using contrast in printed material, such as white letters on dark paper, will help their vision to stand out. Making sure to gain the person's attention before speaking to them and identifying yourself. Using a nightlight in the bathroom and hallways. And eliminating glare is important because glare is also a common cause of concern for the general older adult population as well. Educational points for hearing include it is important to never assume that hearing loss is directly related to old age. So if you have a patient who is older, don't just automatically start talking loudly because their hearing could be caused from something else or their hearing could be fine. Gaining the individual's attention before speaking will allow them to read lips if necessary and be prepared for what you're about to say. Verifying the information provided has been clearly understood and that they do not have any more questions or concerns is important. And reducing background noise, such as turning off the television or closing the doors and taking them to a private space if necessary so that they can hear and focus. Education on hearing continued is using careful and concise articulation and moderate rate of speech, avoiding excessively loud noises, and to prevent further injury to the ear by avoiding cotton-tipped applicators and other cleaning materials. And here are the references.